So my name is Robert Childs. I'm the Executive Director of the North Carolina Harm Reduction Coalition. I'm here today with Representative Glenn Bradley, and we're just going to talk about harm reduction and the war on drugs in North Carolina. So, Representative Bradley, I wanted to ask you, what are some of the negative effects of the lack of syringe access in North Carolina to law enforcement and the people?
Well, one of the biggest issues that we have is that the law enforcement community who actually spends their times and their jobs out amongst every aspect of our community, they're dealing with intravenous drug users every day, and when they suspect a crime, the first thing they do is they go and they frisk the person to find out if they're safe, if they're carrying a weapon, and a lot of times they get stuck by needles. And the issue is a lot of these needles carry hepatitis C, which is devastating, HIV, AIDS, and not only is this devastating on a personal level for the law enforcement that's affected, officer that's affected, but it's also devastating to the budgets of the police department and of the state, because when a police officer is injured in the line of duty and it turns out that he acquires a debilitating disease like hepatitis or HIV, then the bill for that is on the taxpayer. And not only that, but also even in the community, the lack of clean needles for intravenous drug users makes things a lot more expensive to the state, because these drug users who get hepatitis, who get HIV, they end up poor, destitute, and in our hospitals getting emergency care, and that money as well comes from the taxpayers. It's not a question of trying to give drug users an easier way to fulfill their habit. It's a matter of reducing the cost to the state, reducing the cost to the local law enforcement officers, and reducing the harm to the law enforcement officers that are on the front lines doing the job every day and keeping them safe to keep us safe.
I'm really glad you highlighted those points. In North Carolina, we know 1 out of 3 law enforcement members get a needle stick in their career, 28% get multiple needle sticks, and HIV costs the taxpayers $660,000 for each case, and hepatitis C, it costs them between $120,000 to $500,000. So that's a really great burden on the taxpayer, and as a fiscal conservative, I'm really concerned about that because I don't want to pay those costs when they're entirely preventable.
And beyond the pure dollar cost, we also have to account for the cost to the families of law enforcement officers who are burdened by these, horrifying diseases that will be with them for the rest of their lives.
Yeah. Absolutely agreed, and also on the departments who have to pay for post-exposure prophylaxis,
that's right,
which costs thousands of dollars to the departments that they could be using instead for increased employee benefits and increased employee services. So thanks so much for talking about that. I really appreciate it. I was also, one of the other questions we had is I was wondering, what can we do to improve the rights and also the services to people who are living with HIV and hepatitis in North Carolina, and what are some of your ideas to help them out?
Well, that's obviously very tough, and one of the issues that we have is the cost of health care in North Carolina and the United States today. And the big thing that's increasing inflation in the cost of health care, we have a lot of the HMOs and these different insurance companies that stand in the middle, and they charge the customers more than they should, and then they pay the doctors often less than they should. Yeah. And what that does is it has the effect of inflating healthcare costs to the point where the normal person can't afford it. If healthcare costs were more where they belonged, it would be a lot easier for advocacy groups and volunteer groups to raise enough funds to help take care of people who have been infected with HIV and hepatitis and other debilitating diseases. So I think one of the first issues is getting the cost under control, because once the cost is under control, it's going to be a lot easier for those services to come up from the community. In terms of services coming from the government, I think the best role the government can play in an issue like this is to make it an easier environment for volunteer groups to get involved. And the reason I stress that so much is because the volunteer groups are the ones that have the passion for it. When you start mandating this from the government level, then you start putting people in there that don't really care about the subject, that are just hired, they're doing a job. The quality of care goes down, and maybe the people don't receive the services that the taxpayer dollars are paying for. And you end up with a situation where you start getting more and more tax dollars in, and you get less and less services out, and we're back where we started. So I really think that the solution to that is from the communities, from the volunteer groups. So what we as a legislature have to do is we have to make that environment proper for that to actually flourish. And really, almost everything the government touches goes bad. So I'm always very, very sketchy about looking for government solutions to things, even things that are a good thing, obviously. But everything the government touches, it goes bad. So I'm always really reluctant to get the government involved in stuff. But I think that we can help create an environment to where the volunteer groups and community groups can have a much more effective impact on that issue.
Thanks so much for sharing that. And I have one last question
Certainly.
for you. And I wanted to ask you, why should Republican legislators support syringe decriminalization?
Well, that's obvious. If Republicans support syringe decriminalization, it's going to save the state millions and billions of dollars in the long term. Because when you look at the cost of, as you said, prophylactic drugs, that if they get a needle stick, they take these thousands of dollars worth of drugs in order to prevent HIV infection and hepatitis infection. Well, these are thousands and thousands of dollars that happen again. It happens daily throughout the state of North Carolina. And then for the officers who actually get sick, who actually do pick up HIV or hepatitis, now you're talking about $500,000 per person that's added to that, and that happens with some regularity. And then, of course, you have the community, users in the community who would otherwise stay healthy if needle access were legal. Because it's illegal, they use dirty needles, they share needles, and these people go to the emergency room for treatment, and that goes back to the taxpayer. And again, you're talking about close to $500,000 a year per person that eventually goes back to the taxpayer. So literally, you're talking about millions of dollars per year that get spent on this, billions of dollars in the long term. And Republicans are fiscal conservatives. Republicans want to save money. The more money we save, the more we can give back to the taxpayer that doesn't have to be paid in the first place. And that's important. If we let the citizens keep their money, then that's going to help stimulate the economy. And that is a fundamental Republican principle.
Thank you so much for sharing your time today, and we really appreciate all the time you've donated to us today.
Absolutely, I appreciate it. Thank you so much, Robert.
Thank you.